I have been in dentistry since I was 15, and I love dentistry because you change people's lives through their smile. My role here at Jason White Dentistry is I am the head dental assistant. Here with Dr. White is where I first started full mouth reconstruction, and I was excited from the very beginning, just learning that not only are you giving somebody a new smile, but you're usually changing their health for the better overall. So it's not just, one aspect. There are a lot of things that we do with that. I have attended an over-the-shoulder course where we got to see a live patient in Salt Lake City, Utah, and we learned everything there. For our smile design consult, we show them before and after pictures of cases that we've already done, so they can see somebody was almost in the same position that they are, and show them where we can take them. Their first appointment is a consult with Mary Fran, our treatment coordinator. From there, once they decide to do treatment with us, their next appointment is impressions of all of their teeth. We do a full set of x-rays, and we take a lot of pictures, not only to help with where we're going to go with our full mouth reconstruction, but also to show them where they started, and that way when we take our final pictures, they see how far we've brought them. A wax up is a blueprint, basically. It is a map. So again, it shows us where we can take them before we take them there. It's very vital in our temporary process, but the most important part for the patient is that they can see where they will end up before we even start. So when the patient comes in for their treatment day, they are with us all day. We block out our day. They are the only patient here with us that day. They have our attention 100%. It is a long day, but we make sure that they're very comfortable. And then when they leave in temporaries that look just like their wax up, which is another reason the wax up is so vital. So when they do leave, they already have a beautiful smile. They sit in those temporaries for about 4 weeks. And in that 4 weeks, their impressions are being made and molded by one lab technician. So this one lab technician has a minimum of 16 years experience, and he handcrafts every single crown. So not only are they getting good quality work, but their crowns match. They're all made by the same person. We contact Arrowhead Lab before we have a full mouth case, so they already know to expect impressions from us. Once they receive the case, Dr. White and I receive emails, we receive pictures, personal phone calls. We have one technical support person that works directly with our office, so she knows us by name, she knows our cases, she knows everything. So they communicate with us, and we make sure that everybody is on the same page as far as the patient's treatment and where we're going to end with that patient's case. As soon as we put their crowns in, any regrets that they had have left their minds. It's life-changing. We've had patients cry. Men who have never smiled before smile for the first time, and continue to smile. When they come for their follow-up, the answer is always, we've changed their life. They're excited, they're happy. They don't regret their decision at all. The patient can be confident that we are 100% knowledgeable at what we're doing. We already were utilizing a lot of the techniques that Arrowhead showed us. So again, going to the laboratory that we use was basically just touching up on what we already knew. Again, we learned, different techniques that we could utilize, but we were already doing an amazing job.